Okay. Well, thank you, everybody. Before we start the meeting, I'd like to acknowledge the traditional custodians of the land in which we gather here today. So I'm at Brisbane and Tenerife head office. So I'm in the land of the Turrbal, Yagara and Jagera people. I'd like to pay respects to elders past, present and emerging. Does anybody else want to acknowledge any of the traditional owners of where they are?
I'd like to acknowledge the Gubbi Gubbi people.
Good. Thanks, Laura. Anybody else? Cool. Okay. Thank you, everybody. Well, welcome tonight. It's thank you for everybody for attending at such short notice. We will work out a roster for this, so we are going to pay you for your time this evening. Leanne, is there a way of making sure we've got everybody who attended name-wise? If anybody of you have got your names on Zoom as things like user Ruth, or anybody where you don't have your full name on it, can you please email marketing just to let them know that you've attended tonight? So people like Brett or Craig or Ethan where your name's up, you don't need to do that, but anybody where you don't have your name on your profile, if you could email Leanne at marketing just to let them know that you've attended so that we can pay you for your time. So, or put your name in chat. Thanks, Jen. Okay, welcome everybody. So I'm just going to go through the update on our response to the pending lockdown. That's, in fact, it's already gone. So 5 o'clock today, Queensland Government have forced a 3-day lockdown due to COVID-19 response. So I'm just going to go through some of the actions that ARAFME have put into place, the rationale for why, and just give us a chance to talk about anything that we might need to, or clarify any direction that we've given. It is slightly different from the last lockdown in terms of the government recommendations. So we'll have a chance to talk about that, and then we'll give you some more information about our EAP service, Amavita, and we'll put that up on the screen and talk a little bit more about the types of support that you can get. So you would have all hopefully have got the email that we sent out, and that's why you're joining us tonight. So I'm just going to go through a list of some of the implementations that we've made. So for people who can and are able to, all office staff will be working from home. Now, myself and 2 other people will be in head office for the rest of the week because we don't have the same working from home facilities. And I think there might be 2 staff in Ipswich as well, but all of the office staff will be working from home. And from the back end, so things like our carer support team, all carers and any services that we were going to have delivered will either go online or will offer some alternative supports. So that's the working from home, and people, it says in the email, we'll be back in the office, or we'll be working till 5 o'clock Thursday, the 1st of April. But we've got Easter weekend this weekend, so that's Friday coming, and Monday afterwards will be on public holiday. So we're hoping to see everybody back in the office the following Tuesday. And I can't remember what date that is. Let me just check my calendar. Yep, so Tuesday the 6th we'll be back in the office. Thanks, Leanne. For those of you who are working on shifts, so anybody who's working directly with clients, or indeed those people who are working in the office, face masks will be mandatory while you're on shift. And again, I know that for some people that's particularly challenging, and I don't enjoy wearing a face mask myself, but when we're on shift, that will be the mandatory requirements. If you feel that you're not able to do that, or you do have some medical or other reasons for not being able to wear one, can you touch base with Laura Grant in the first instance? So I know you've all got different line managers, but Laura will be the point of contact for that at the moment, because we want to make sure that there's a senior level sign off and that we can provide information to the board about why somebody might not need to wear a mask. So if you're not able to wear a mask while you're on shift, please let Laura know, and if Laura's not available, let myself know, and we'll work out something there. But unless there's any restrictions to that, when you're on shift, everybody must wear a mask. That includes supported independent living, short-term accommodation, and all community access shifts. So even on the supported independent living shifts, where I recognise you do have some space to have some kind of social distancing from people. We're still requiring you to do that at the moment. And I'll just check if there's any chat or questions on that. Are there any questions on the masks? So Fiona's raised a question: if a client gets offended by us wearing a mask, I think it's a good opportunity to talk to people about the legislation and why we have the lockdown in place, and that it is an organisational requirement. I think if there are any issues, we can get one of the line managers to talk to that client directly, but it will still be a requirement. Laura, do you want to touch base on that around anything? So if a client gets offended by us wearing a mask on shift, any other recommendations for how a member of staff might deal with that for the next couple of days?
Well, I think just like you've said, reminding them that it's a government requirement, that they're also required to wear a mask if they're out in public. Even if we're in the home, they need to understand that we're still working, we're in the workplace, and that still applies to us, even though they might be in their own home and not required to wear a mask, we still will be.
Cool, thanks, Laura. And just a couple of follow-up questions. I'll get to the one on Fairbank House in a second, but Libby said, should we be asking clients to sit in the back seat of the car as well? Yeah, that's still that's not changed, I think, in terms of the social distancing requirements. So if you are transporting somebody in your car, back seat on the passenger side, just in terms of social distancing, but the employee should be wearing a mask. No, the employees should be wearing a mask for that, Jason. Ideally, clients would be wearing masks as well, and we can ask clients to do that, but we can't force them. So we don't want there to be any conflict or any issues or challenges around that. But if clients are comfortable wearing masks, that would be great. And Pam's asked, do the participants have to wear masks in short-term accommodation? No, they don't, but I'll talk you through our intake procedure for that in a minute. So let's go back to Fairbank House. Do we need to wear masks when the clients go to bed? And I'm assuming that's in supported independent living and short-term accommodation. That's a really good question, and I don't know. So Laura, do you have any thoughts on that in terms of the safety? And we'll talk about this now, and then we'll give you a definitive decision in the next minute.
I think if you're in the office, if the client has gone to bed and you're sort of winding down for the evening, they've gone to bed and you're in the office completing your notes, I think it's probably okay because you're social distance. You're not going to have anyone in contact with you to take your mask off for a little while. But I think still be mindful that you don't know that there's any time that they might hop out of bed. So just because they've gone to bed isn't a guarantee they're not going to rise again.
Oh, good point, Laura. Okay, so just clarity around that, and Leanne, we might, Leanne, if you're okay to update that on the all staff email that came out, just to clarify that. So when participants have gone to bed and you're in supported independent living or short-term accommodation, you can take your mask off, but I would keep it on your person or a fresh one on your person, and that any time you're with the client or the client leaves their bedroom, you must put it back on. Any other questions about that? David, I'll get to your question in a second about CAS, but any other questions or clarification needed about wearing masks when you're on shift? I'll just give a couple of seconds for people to respond to that. Cool, okay, so if there's no other questions on that, that's great. I'll move on to community access. But if there are things that come up, please email marketing around that and we'll formulate a response. We do talk about things at length, but invariably we'll miss something at some point, or like that really good question around what we do when people go to bed. We hadn't thought about that when we were talking about the protocol, so thank you for bringing those things up. So David's asked, have the hours been changed for CAS with the amount of time we spend with clients? The hours haven't been changed that I'm aware of, but what we're doing for the next 3 days is cancelling all non-essential shifts. And non-essential is defined as, essential shifts are defined as a shift that is required to take place, otherwise there's the potential for harm or neglect. So where a client needs to have a shift for their own safety or well-being, those shifts are still going ahead. But anywhere it's more about working towards the participants' goals and not essential, those are cancelled for the next 3 days. But I might ask Kerry and Gary to, and I don't know if Jade's online as well, but if you're there, just to jump in and confirm, have any of the essential shifts, have those hours been reduced at all, or are they just going to stay as standard shifts, if that question makes sense? Either Kerry or Gary?
Yeah, I don't know if I'm muted. Can you hear me?
Yeah, I can hear you. I don't know if we can understand your accent, but I'll translate if we can.
That's okay, that's okay. I know that I have been phoning a lot of clients and I've been trying to phone as many staff as I can, but I'm time limited. There has been some shifts that have been cancelled, so if you just keep an eye on the roster, this will be when the client's turning around and saying that it's not an essential shift and they're quite happy to probably just miss this shift this week, and hopefully they'll just get reinstated next week. So hopefully there won't be too many disruptions over the next 3 days.
Yep. Cool. Thanks, Gary. And Gary, has there been any shifts where they've been essential shifts, but we've shortened the time of them, or have we just kept the shifts as they are?
No, the shifts have pretty much remained the exact same. I don't know if, David, if you touch base with me and you're worried about maybe there's a shift that's too long, because I know that you do some long hours with some clients, and you don't see it's needed, then just get in touch with me and we can phone the client and see if we can sort that out.
Cool. Thanks, Gary. Kerry, is there...
Sorry, Irene. It's just that with Wednesday I have an 8-hour shift. However, we've got to go into Brisbane by train for that shift. So what happens there? Sorry, Irene.
So yeah, David, and I think that's probably one of the ones we might take most of it offline and to talk to Gary about. But if for any client where it's attendance to a medical appointment, I think that's a reasonable necessary shift. If it's about attending something else or going for a leisurely train trip or something like that, then we wouldn't class that as an essential shift. What we could do as well, we do have a few RAFME vehicles, and I have one based at head office as well, so you can use the RAFME cars. I think that's a reasonable thing to do in replacement of trains, and I know that public transport's ideal for people in terms of independence and capacity building, but in this particular situation, I wouldn't be recommending anybody or any staff go on public transport while we're in lockdown. So David, are you comfortable with that as a vague generic answer, but talk to Gary or Laura about the specifics for that particular client?
Took the words out of my mouth, that vague generic. No, it's just that, like, getting there, but then afterwards, we come back, what do we do then? And I know I've got a shift tomorrow where the client has to go to the chemist to get some painkillers that he can only get from the chemist. What do we do after that? Other than
that's fair. Yeah, and I think some of the things that you've got some great conversational skills, and I know you've got no problem engaging clients, that if there were things that were less than practical but they were recovery focused or well-being focused in the person's own home, I think that's okay. But I think if it's longer shifts or booked in to do particular exciting things or interesting things, then I think those should probably be cut short to allow just for the essential practical elements of the shift.
Okay, so I'll bring out the wigs and the frocks. Okay.
Perfect. And please take pictures and send them to us. Cool. So thanks, David. That was a really good question. But just to confirm for everybody with any of the shifts, keep checking your roster. There will invariably be some changes over the next couple of days, but it is only for 3 days until we know what's happening with the lockdown. And again, last lockdown was 3 days and we were out pretty cleanly. So let's hold the hope that can happen again, and work with clients on those resilience strategies over the next couple of days. But it is only a temporary arrangement. But if you're not sure about shifts or you're concerned about a particular shift, touch base with your line manager. Now, I do know that Gary, Kerry, Laura, and I think Kelly and a few people, their phones have been red hot today. So if you don't get through to them first thing, flick a text or an email and we'll follow up with you. But we have all been pretty busy on the phones trying to arrange things. So if we haven't got to you yet, it's not that we don't care or you're missing out. It's just that it's been a particularly busy time trying to respond to this. So thank you for that. Luke's asked, where can participants shop for groceries? So we would recommend local shops for local people at the moment. I'm not endorsing going to any large shopping centre or any place where you can't guarantee social distancing. So I recognise that that might limit the client's choice of shops to go to, but I think your priorities, like your safety is our priority. So I do not endorse anybody going to any large shopping centres. So local shops where possible. And if we think back to when we had the COVID restrictions last year and we had I think it was you don't go to the next suburb. I think you can use that as a general sensible guide to what we're trying to do. So really the next 3 days, essential shifts only. And I would argue that an essential shift is not travelling 3 suburbs down the road to go to a Coles superstore or things like that. But again, if there's any specific individual instances of where you think that you might need some support with that, or you might need some guidance, touch base with Gary or Kerry or Kelly or Laura around those individual circumstances, and we'll talk you through them. Does that make sense in terms of the shopping aspect? And indeed with any of the services that you're providing, local and where we can, social distancing and absolutely masks on at all times. Okay, so I'll move on to the next part. So some of and this is government legislation around all of the recommendations for local authorities. So no visitors to short-term accommodation, medium-term accommodation and supported independent living. Now we are going to enforce that for the next 3 days and then we'll review that on Thursday. There will invariably be exceptions to that, but the exceptions will have to be signed off by Laura or myself, just so that we're aware of any kind of risk attached to people coming into supported accommodation. So any visitors that do come in must wear masks, and we will include, so if there are people that have service providers coming in to take people out, then that's obviously something that we're not going to stop happening, but people need to wear masks. Any questions about that for individuals, again, touch base with Laura or myself and we'll give you a very quick decision on whether or not we're going to support the person visiting or not.
I also wanted to add something on visitors, Irene. Just ensuring that if you do have anyone that enters, so whether that be for providing nursing assistance, personal care, etc., ensure that they're signing in. So each house or site should have a sign-in sheet that captures the time they entered and departed, but also have details like phone number, just so that in the event that we do have a positive case, that we can support with contact tracing.
Oh, good point, Laura, thank you. No, we've got a message from Brett saying that you've heard nothing and your audio won't work. So you're probably not hearing this, Brett, but Leanne or Jen will message you in the background and this recording will go online afterwards. So anybody that is missing out, it's going to be recorded and put on YouTube like the rest of them. So people will have a chance to see it. Let me just run through my list quickly of everything else that we need to talk about. So we've talked about working from home, face masks, visitors to STA and supported living, short-term accommodation. So we've had a look at the guests list, etc. for short-term accommodation, and we won't be allowing any check-ins, if that's the right terminology for it, from today at 5 o'clock until Thursday at 5 o'clock. Now we've had a look at that in terms of who that impacts, and there's only 2 clients across Arafme that impacts, and Kerry and Jade are in the process of being in touch with them at the moment. So people are staying in short-term accommodation at the moment. We're not asking them to go home. They can still receive their supports All employees will be wearing masks, and we won't be taking any more intake to short-term accommodation until Friday, pending any changes in the lockdown, and we'll know about that Thursday. We should know about that on Wednesday, actually. The Queensland Health have said they'll give us a further update on the lockdown on Wednesday. So if there's any changes to that, we'll let you know, but it's only 2 people that have been impacted. In terms of our thought process around that, last lockdown, we did say that if people's safety or health and well-being was at risk by them not attending short-term accommodation, we would make exceptions. And just to reassure you, that's the same process that we followed this time, but we're comfortable with the people that we've said will postpone their stay, that there's no risk to their well-being or health and safety. So we do take that into account. Are you there, Brett? Can you hear us now?
Yeah, last time I went on Zoom, I didn't have to dial in. I just clicked into the link and then it opened and I was able to talk. So
yeah,
well, anyway, I'm here now, so that's all that matters.
And it is. And just to reassure you, this one's been recorded as well, so you'll be able to access it. There's nothing different to what we've sent on the email out around our restrictions, but just more of a detailed response and some Q&A. But it is recorded and it'll go up on YouTube. It's
pretty much the same as it was previously, as far as restrictions and wearing of masks, and as far as I can tell.
Yeah. Nothing massive. We've been here before. Cool. Okay, so I think that's everything in terms of the actual work side of things. What I would encourage you to do is, on the link that the marketing team have sent out, is the most recent updates from Queensland Health, and I'd encourage you to have a look at that on a regular basis, because the contact tracing area has significantly increased since yesterday. So there are multiple areas where Queensland Health are asking people to come forward and get tested and then self-isolate. So if you could keep having a look at that and check whether or not it's applicable to you. We do have the forms for clients that we'll send out with an updated checklist, and we'll be using the same checklist as we've used previously. So Jen's just sent, if you have a look on the chat function, Jen's just sent out the contact tracing link at the moment. So I'd encourage you to have a look through that. I think there's a few people on staff who either recognise those areas or have been in them at some point, and we know we have quite a contingent of employees in the north side. So just have a look at that and keep an eye out. If you do need to get tested and self-isolate, can you touch base with us and let us know as soon as possible, and we'll talk you through any supports that we can provide from a work perspective. And likewise with any shift cancellations or anything that we've had to do over the next couple of days, if you're financially impacted or you're worried about income, etc., can you touch base with us, and we'll work through some supportive options for you. So I think that's it from the organisational side. Can I put a call out for any questions on anything that we've talked about so far, or if anybody wants any clarification on any of the instructions? So I'll just give you a minute to do that. And while we're waiting on that, Leanne, can you shove up the Amavita EAP poster?
Irene, can I just mention something? You mentioned about the contact tracing locations. I think it's really important that people keep abreast of it, because I've been looking at during the day, but there's ones that are coming now from as far back as the 19th of March. So it'd be great if we could just, make sure that we continue to be across it. And some of us, there's been some near misses for me on a few of these, I can tell you right now.
Yep. Yeah, no, likewise, Sean, thank you. Yeah, just to reiterate what Sean's said, just keep an eye on it. I would check it regularly. I know from a work perspective, we're looking at the information every hour to see what the updates are. So just as for your own personal well-being, but also in terms of how we manage the work environment if you're potentially exposed, would be really helpful. Now we've got, I think there's a couple of people maybe not on mute at the moment. I'm not on mute now, am I? Was I on mute before when I was talking? No. I could hear some background noise, but I think that's all gone now. Okay. So what we'll do, there's no questions come through in the chat. Thank you. Now, what we've shared on our screen at the moment is our new employee assist program. So it's Amavita. They're a wider Brisbane-based organisation, but they do provide international services. So we've changed our employee assist provider, partly because we got feedback that online or not face-to-face didn't work for everybody. So Amavita do both face-to-face and online supports, and they provide a wider range of services than we've previously experienced. So we've got their details up there. All of the information should be out on sites now, but I'll leave that up there for a second, and if people can take a note of the telephone number at the bottom, and I'll read it out to you, and the email address. So the telephone number is 0490 049906. And the email address is Wes, which is WESS @amavita.com.au. And WES stands for Workforce Employee Support Service. So it's not just about areas where you're you might be negatively struggling. It's about positive engagement with supports too. And just to reassure you from the last time we spoke as well, that your family are included in access to this supports. So it's not just yourself if your family are struggling. And we recognise that lockdowns do create financial stress, psychological stress, physical stress. This is somewhere where you can access some support. Any questions on the EAP side of it? I think we can take that down now, Leanne, if you're comfortable. Thank you. Nope. Okay. So I think that's all we wanted to talk about tonight, and just to check in with everybody to see how they're doing, and to say, like, thank you for your responsive support. Again, I think the way that the organisation pulls together with these things is fantastic, and we pull together as a team because you all as individuals bring that culture and that commitment. So I do want to thank you for that. Laura, before we go open to any other comments or questions, is there anything else you want to add about the next 3 days, or anything that employees should be looking at, or anything they might need from you?
I think kind of what Sean was saying about the contact tracing list, I think just be mindful of clicking on the link. So if you're someone that has to perform the COVID screening checklist for clients, make sure that you're accessing the current information. Don't print it out and have it there, because it, like Sean said, it is constantly changing, and you want to have all the up-to-date information.
Cool, thanks, Laura. So I'm going to open out to anybody else. Does anybody want to ask anything, any questions or anything that you want to make comment on? Chrissy, thank you for you're amazing. You're amazing too, Chrissy. Thank you. I really appreciate that feedback. The intent is to try and talk through not just our decision making, but our rationale for things. And I know sometimes we do need to make decisions in the absence of everybody being involved, but we do try and make collaborative decisions about everything we do and try and explain them. And I think we've got over 170 employees at the moment, and I know not everybody will agree with every decision we make, but I do think it's important that we talk through them and give people a chance to talk over it. But thanks, Chrissy, I really appreciate your feedback on that. Anybody want to make any comments or give us feedback or have anything clarified about where we're going to be at for the next 3 days? You're a quiet bunch tonight. Okay, well, thank you for that. I really appreciate you coming in. I know it was very short notice. We will make sure you're rostered for this one. And we're working on making sure that we can do that. Laura's sent me a prompt. So sorry about that. We have had a couple of questions about the COVID-19 vaccine. And I'm going to be intentionally vague about that at the moment, because we're waiting on Queensland Health giving us further information around the category that we're in as employees, because technically we're not disability support workers, we're community service workers, so we're waiting on confirmation about when we'll when we'll be supported in that round. That a couple of staff have asked about support letters. We will get those to you, hopefully within the next couple of days, but in reality, we might be looking at Tuesday, Wednesday next week. So we are in the process of getting letters of support for all employees around the status of your employment and what you do, so that you can look at vaccine. But we are waiting for Queensland Health to give us some guidance on our processes internally doing that. So we don't have much information to give you at the moment, but for those of you who've come forward wanting to ask for letters of support, we will give them to you, but we're working on a template at the moment. Does that make sense to everybody in terms of vaccine, and is there anything that anybody wants to have clarified about that particular area? No, cool. Okay, and Ruth, you forgot to get the phone roster. Yep, we'll sort that out. Alex, if you're Alex Tyson, if you're able to touch base with Ruth around the carer support roster, we'll get that sorted. Yeah, sorry, Brett, were you gonna? Yep.
Yeah, I'm just wondering, will it be essential for us to have the vaccine?
Yeah, at the moment we don't have. Good question, Brett. At the moment we don't have any legislative requirements for it, and if there are, we'll work out a process of how to support staff to get that. But at the moment we're not anticipating it because of the types of service we do. But if it does become mandatory, we will have to implement that. But I don't have any details on what that might look like, and I appreciate that some people might have concerns about that, but we'll work through that on an individual basis with people if that is an issue.
Yeah, I just thought it, well, to me, the way it seems to be going is if it'll be essential, and if you want to retain your position at any given place of work, you'll probably be, well, in a sense, forced to have the vaccine.
Yeah, and Brett, and it's a bit of probably a philosophical conversation that we could have over a cup of coffee rather than...
Yeah, of course. I don't want to go into too much detail either.
Yeah, but I think that if there are individual circumstances, I think RAFME have got a track record of looking at individual circumstances and supporting people with things that we might normally think, well, it's too hard basket. I think we'll do that, but I couldn't really say any more about that apart from if there is legislation, we will be required to follow it. But again, we can touch base around any individual circumstances if and when that happens.
Oh. You've been keeping us up to date with everything, so thank you.
Even with the things we go, I just don't know. I think it's better that we tell you we just don't know rather than leave it blank. But thanks for asking that question, Brett. Okay. Yes, Jason?
Sorry.
Yep.
I do have a question. I didn't know whether I was going to ask my line manager, but I think I'll share it with everyone just in case.
Okay.
I had a support today with somebody, and when I go in, I do the QR code for the contact tracing. And it said, I put my details in, that was good. And then it asked for another person if they wanted to be checked in. So I did the details of the person, but they didn't have an email address. So I couldn't save their profile. So I'm just wondering, is it okay if, in that case, if the worker just puts their details in, and then if there's a contact tracing come up, they can get to us to find out who we were with that day? Or whether...
Yeah, as long as it's your, it's a good question, Jason, and I think as long as it's your RAFME email address, then that's not a problem. Okay. Yeah, so if clients don't have email addresses to put in, or they're not able to do their own individual contract tracing app, then use your RAFME email address, and that will be fine. It just, as long as you're keeping an eye on it, but you'll be doing that for your own perspective anyway. I think it's probably important that there's separate phone numbers, and I'm making an assumption that most clients have a phone number of some kind that they're able to be contacted on. Would that be fair? I think if there is anybody who doesn't have one, that we can look at that on an individual basis. So maybe that's something we can do as a team. Laura, Gary and Kerry, can we have a look at that tomorrow? That if clients don't have mobile numbers or numbers that can be contacted in the event of tracing, that we we'll come to an agreement around what we do with that. And it might be that we provide a mobile number that we can support with, but I don't want that coming back to individual members of staff or their own personal mobiles for client related issues. Laura, are you comfortable with that as an action?
Yeah, that's fine.
Cool, perfect, cool. All right, and Liz has said putting the client code in as a dependent, never their full details. Laura, do you have any views on that in terms of should it be?
I think because it is a government requirement, it is okay to disclose their details. I guess that's one of the instances that we could disclose a client's details, and obviously with their consent as well. But I think worth noting, I've experienced this myself when, you know, technology is technology and not always reliable, that most venues do have a paper-based version that you can write things. So if you have people that don't have phone numbers or email addresses, they can fill in that and just have their address. Might be something exploring if you encounter that on an ongoing basis.
Cool. Cool. All right. Thank you, everybody. Okay. Any last final questions or comments or thoughts before we say goodbye for the night? Well, we'll see all of your animals before we say goodbye for the night. That's mandatory requirement. But anything before we leave you for the next couple of days? Cool. Okay. Thanks, everybody. So thank you again for all of your support. It's been a wonderful attendance tonight. And I just want to acknowledge that the timing of this absolutely sucks. We know that you're coming up to Easter weekend. We know you're probably, for most of you, looking at having a break and enjoying time with your families. And I just want to, I'll hold the hope for you that that this will end on Thursday and that you're able to do what you need to do. But I do want to acknowledge it's just a rubbish time for this, but I do appreciate all your support and the way you pull together to make this work for clients. So on behalf of the whole organisation and the clients that we're providing wonderful support to, I really do want to thank you for that.